Hey everybody, how you doing today? This is Jim Prusak, physical therapist, coming at you from the Pain PT, and I want to talk to you today about the importance of getting a diagnosis of a brain and nervous system component to your disorder, to your health condition, whether it's chronic pain or another chronic health problem in the body. And I think this is really important because getting a diagnosis and getting a confirmation that the brain and nervous system are at the root of your problem really can set you off on the healing course of getting better, to understanding how this works in your body and the knowing that you can heal. Because otherwise what happens is we stay stuck in the physical realm. We stay stuck seeing doctors and healthcare practitioners that just work on the body, right? So we want to get a diagnosis that's comprehensive. We want to make sure that it's not structural, because there are structural issues in the body that can cause pain. We know that. But we also know that the longer conditions go on, the longer they last, the more likely there's a brain and nervous system component to it. So I just want to talk to you a little bit today about how we do our assessment and our evaluation to make that determination or make that diagnosis. And we call this the diagnosis TMS, or tension myositis syndrome, which Dr. Sarno coined many years ago. It's more recently called PPD, psychophysiologic disorder, or MBS, mind-body disorder. It's all the same thing. And so I want to let you know there are resources out there. There's physicians and other healthcare providers that can do an assessment on you to make this diagnosis. I recommend you go to the PPDA website, Psychophysiologic Disorder Association. It's a nonprofit, and they list on their page a whole host of healthcare providers throughout the US and the world that can do an assessment. Someone like myself, who's a physical therapist, I also make these assessments. I've worked with pain conditions for over 20 years as a physical therapist. So I specialize in chronic pain and also work with other chronic health ailments. So here's what we do. So when we do an evaluation, we start with the basics, just like when you go to your doctor who does a physical evaluation. We want to look at the body, start with the symptoms. We want to know what they are, where they are. We want to know when it started and how it started. Was there an injury, or did it come on gradually over time? We want to look at any medications you're taking. We want to look at your past medical history. We want to do sort of a physical exam. And so this is stuff that's typically done when you see a healthcare practitioner. We're focusing on the body, but that's only a small part of this mind-body assessment. So that's where the buck stops with the physical assessment. We like to go deeper. So I'm going to ask you questions about your life, who you are as a person. What's your personality like? Dr. Sarno was amazing in that he was the first doctor who was able to link up personality characteristics with the risk of developing chronic pain and other chronic health problems. And these personality characteristics are things such as perfectionism and do-goodism, always trying to help other people, people-pleasing, being conscientious and hardworking. These type of things put a lot of pressure on ourselves, and what they do is they sensitize the brain and activate the sympathetic fight or flight part of our nervous system. So we want to see who the person is as a whole. What's their personality like? And if we go back in history, we go way back to 300 to 400 BC, Hippocrates, who was coined the father of medicine, he was a physician, a Greek physician. He basically had this quote that's always stuck with me. He said it's more important to know who the person is than what type of disease the person has. And this is exactly what we're talking about here, is we don't want to know just what the disease is or the problem is. We want to know about the person. So the personality characteristics is one aspect of that. Also want to know from early life to adulthood, what life has the person lived? What have they been through? What type of stresses have they undergone? Did they have some adverse events in childhood? Have they had a lot of stresses into adulthood? Do they have anxiety? Do they worry a lot? Depression? Other things such as that. I want to know who that person is. I want to get a deeper understanding of who they are. And also, I want to know around the time the pain or the other health condition started, what was going on in the person's life. What were they doing? Where were they at? Were they undergoing some stress at the time or life changes? What was happening around the time the condition started? This is really important. I also want to know more about the person's medical history, and not just physical conditions, but all conditions. I have a list of at least 35 conditions that can be influenced or caused by the brain and nervous system. So I want to see if people have had some of these conditions in the past or currently have some of these conditions, because it adds more weight to adding up to being a brain and nervous system problem. The other thing we want to look at, and I look at, is how much physical treatment have you had? Who have you seen for healing? Who have you seen? Was it doctors? Did you go to physical therapists, chiropractors, acupuncturists? What healthcare providers and treatment have you had? And the more you've had with less success, the better, actually, because it proves to me that it's more likely to be a brain and nervous system problem. Because we know the body heals. We know that these type of treatments can be helpful for people to heal from acute and subacute problems in the body. But when we get the chronic problems, they don't work. And that's because we're targeting the wrong source of the problem. We're targeting the body structures when really we should be targeting the brain and the nervous system. So we know there's 20% on average of people in the world who go on to develop chronic problems, from chronic pain or other chronic health issues like IBS, fibromyalgia, migraines, digestive issues. There's a whole bunch of stuff, chronic fatigue syndrome. There's a lot of conditions that just don't heal, and they actually get worse over time. And with these things, a large percentage of the time, it's more because of the brain and nervous system. Because 80% of people get better. The vast majority of people heal. And in the 20% who don't, it's typically not a physical structural problem that's continuing to cause the issue. So we want to rule that out, though. We want to look at X-ray, MRI scans, any scanning reports you've had, and look at those results. A lot of times people have things that show up on these results, and the doctors pin that as the cause of the pain or cause of the problem. But many times we know through the science and the research that there's a really poor correlation between structural changes in the body, or what people call pathology or abnormalities, and pain and other health conditions. So we have to be really careful not to pin the source of the problem on a structural cause when there's a lot of people walking around with all types of changes in their bodies, but they don't have pain or they don't have other health conditions. So these are the things we're looking at. We want to put a whole picture together, a holistic view of the person. And I really want to know who that person is. Like I said, I want to know who that person is, what they've been through in their lives. The actual condition, the actual symptoms is secondary to me. It's absolutely secondary, because that's just a output. Usually it's like a superficial thing. We need to go deeper and find the deeper causes of things. A couple other things we're going to look at too, I like to look at, is what emotions people are dealing with in relation to the problem, what it's bringing up for them. Are they dealing with a lot of frustration and irritation? Are they depressed because of this? Are they having feelings of sadness and remorse and sorrow? Are they afraid and fearful and frightened? These are all emotions, and this is part of the condition itself with a brain and nervous system problem. We want to look at the emotions. It's really important. We know the definition of pain is that it's emotional in nature. So we have to look at the emotions and how people deal with their emotions. Do they suppress them? Do they repress them? Are they exploding with their emotions? what's their emotional intelligence? What's their emotion regulation? How do they deal with their emotions when they come up in their bodies? Really important. I want to look at what are the beliefs? What does the person believe about their condition? I talked about this in one of my other videos, that the beliefs are really important. If a person is believing that they're structurally damaged and believing that something in their body is causing the problem, it's going to be really hard for them to heal with this approach, because you have to let that go. And when you get a diagnosis, the whole point of this is to prove to you that it's not a structural problem and to give you the confidence to move past that, because you've heard that from countless healthcare practitioners that there's something wrong with you in the body. So the whole point of this evaluation, this assessment, is to rule out physical structural cause and to rule in a brain and nervous system component or underlying cause of the problem. So this is important that you get a diagnosis, especially if you're struggling with this, you're not quite sure if it's brain and nervous system related or it's structurally related. I think it's important to get this diagnosis from a healthcare practitioner who's trained in this area. So if you have questions, please reach out. This is what I do. My job is wholly focused on chronic pain and chronic health problems in the body. I do these assessments all the time. Or go to the PPDA website and find a practitioner who can do that assessment for you. I work with people over Skype, so distance isn't a problem. I also work with people here in the San Diego, California region. So if you're local, I can see you in person as well. Have a great day, everybody. I hope this helped you a little bit. I want you all to heal. You can heal. I know you can heal, especially if we can make this diagnosis of a brain and nervous system component. You can heal. Absolutely. All right. Have a great day, and we will talk to you soon. Take care. Bye-bye.